Hi everyone, welcome to Fitness Friday by Rose Walk, and our today's topic is back pain in pregnancy and for new moms. It remains a very commonly asked question amongst a lot of pregnant mothers that how to manage back pain in pregnancy and what is the real reason for back pain in pregnancy. So today I have with me Dr. Veenu. Hi ma'am.
Hi, Mahima. Hi, everyone.
So we will be discussing about back pain in pregnancy for today. So let's get started. So, ma'am, what do you think are the main causes for back pain in pregnancy? Why does it happen?
Yeah. See, the body is undergoing a lot of changes during pregnancy, and all those changes have just one purpose: to prepare the body and the uterus for labor and for to carry the baby. So the ligaments are already relaxed because of the effect of hormones, and there is a lot of stretch and stress on the back because of the growing uterus, the additional weight mother has put on. So all these changes give rise to a lot of stress on the back. And besides this, if a person has bad posture, is deficient in calcium, is deficient in vitamin D, has already some other cause for pre-existing backache, like some kind of nerve compression. So all these things can get exacerbated, and the person might feel it more than what it was before pregnancy. So it's very important to, especially for mothers who are planning pregnancy, they plan a lot of things. But I think a good back is another way they should add to the agenda of planning for pregnancy, because it is going to come under a lot of stress.
So yes, so like ma'am mentioned, when you are planning for a pregnancy, it's good to focus on preparing your back as well. So you could start off with some back strengthening, muscle exercises, or postural correction, which can help you to cope up with the back pain in pregnancy. And ma'am, as the pregnancy progresses and as the woman starts putting on a lot of weight, especially around her belly area, and the bump size is growing, does that also add on to more back pain, or the frequency of the back pain increases because of that?
Yeah, because of this, the curvature, the normal lumbar curvature, which we call normal lumbar lordosis, that increases to a greater degree. And obviously, if the muscles are not strong enough, so because of the stretch, and not just back muscles, if a person is not having very flexible body, if there is a lot of tightness in the leg muscles, especially the hamstring, because we see body as body is one unit. It is not back, leg, and everything separate. So anything anywhere can affect the back. Right. So if you're because of what you mentioned, there is stretch and stress on all parts of the body, and all these things can obviously affect the back.
Yes. Also, we would like to talk something more about the sleep posture. Now, a lot of times when moms in pregnancy are progressing towards the third trimester, and when they have a big bump also to manage at the same time, they are mostly advised to sleep on the left side during pregnancy. Now, if we talk about the correct sleep posture, what are the main points a mother must keep in mind while maintaining the sleep posture to prevent aggravation or aggravating the back pain that she might be experiencing already? So, any particular alignment that needs to be maintained during the day or especially during sleep?
Yeah, right. That's a very good point, because posture is something which is not really stressed upon, or we forget. Even if it's stressed upon, we forget. So during the day when one is sitting, if one can be mindful of the fact that ears, shoulders, and the hip is in the same alignment, and if it's not, probably if the person is tired, then person can use lumbar rolls to keep it aligned and take a support. And another thing is, while lying down, it's not advisable, and in fact not possible to sleep on your back comfortably also. So the more left lateral position is used, better it is, and to use a pillow between your knees and ankle, and between your ankles while sleeping on your one side would also really help to decrease the pressure on your pelvis and lower back.
Absolutely rightly said. So if you maintain, like you can keep a pillow between your legs where your knee and ankle is in the same alignment, probably at a 90-degree angle. You can maintain that position while sleeping on the left side, for which a lot of sleeping pillows are also available these days. Or apart from that, also you can just use a nice soft pillow that gives you good comfort during the sleep. And apart from that, you can use some cushion support under the bump, because even when the bump load pulls the back area. It again loads the spine
True.
and increases the back pain. So one small little cushion under the bump will also give you some nice, good comfort and relief from back pain while sleeping.
Also,
And
I'll just interrupt. Also,
yeah,
some pillow under your arm while
Arms
sleeping
also.
on the side,
Yeah,
that
yeah.
would just relieve the pressure on your upper back.
Yes, yes. So then you need good comfort while sleeping. So hence the
Yeah.
sleep posture also remains very, very important, especially in case you are having a back pain during pregnancy. Ma'am, if in case somebody is a working mother and she's experiencing back pain and she still has to continue working, and now because of COVID it's all working from home that's going on, any particular posture that she should keep in mind while sitting, like you mentioned lumbar rolls can be used, anything else you want to mention?
And then taking frequent walks,
Yeah.
so that and I would just like to add here that many times you forget hydration, calcium, vitamin D.
Yeah.
So please be very careful about this. And also while you're working, you can be stressed, and stress can directly and indirectly cause backache. There is no doubt about it. It has been proven. So taking frequent breaks, doing some mindfulness techniques like focusing on your breath, your posture in between your work, taking those breaks can go a long way. It is, I can't emphasize it enough how important it is to do all that so that you are relaxed. And once you're relaxed, your muscles are relaxed. And back muscles are relaxed too. So that can be kept in mind, and in between one can even kind of give some kind of leg support that also relieves pressure on the back while sitting, and work while doing that.
Yes, absolutely. So you can keep a footrest under your legs, which will give you leg support, and it will also help you in preventing a lot of swelling around your ankles in pregnancy.
True.
Good. Ma'am, what would be the best management of back pain in pregnancy according to you?
I think best would be prevention. So start
Most
begin by
important.
yes, begin by strengthening your back. And if you're pregnant and your back is not strong, it's not you can and if you're not familiar with those exercises and stretches, do them under supervision. Be regular with them. Be consistent with them. Then that will go a long way in prevention of backache later on. Lot of yoga postures like cat camel posture and exercises are recommended. Pelvic tilts, which we explained the other day, can be done. And suppose there is a lot of muscle spasm, tightness, a gentle rub, not the vigorous Indian style malish, but a gentle rub with warm oil with some hot fermentation, that can be done. And besides this, I think the regular things of posture and all can be taken care of. And suppose it's not relieved, please don't shy away from seeing a physiotherapist. And then you do those exercises or whatever modalities are advised. And sometimes people go in for other techniques like acupuncture, TENS, which is TENS. So that can be taken care of as on an individual basis. But these general points will help everyone.
Yes, so like ma'am mentioned, muscle strength is something which will really help you in preventing excessive back pain in pregnancy. So regular exercises to strengthen your back muscles, your core muscles will really give you good results. And we at Rosewalk also conduct pregnancy fitness classes in which we guide you on the right kind of postures and asanas that you can maintain during your pregnancy, which will help you to strengthen not just your back muscles but your overall body muscles to prevent joint pains and aches.
Yeah, I would just like to add here. Could you mention that? Because as she said, it's not just about back. Once your leg muscles are strengthened, and especially the hamstrings are not tight, the core is strong, back will automatically be good.
Yes. Stretching exercises are a very neglected side again,
Yes.
because a lot of people don't bother to do the stretches nicely.
True.
And like you mentioned, tightness of the hams can also lead to excessive back
majorly.
pain.
They'll just keep pulling the back,
Yes.
and whatever you do about back, if your hamstrings are tight, it will not be effective.
Yeah, so that's why I think stretching exercises are also very, very important. So do your regular stretches, learn them under proper supervision once, so that you know the safe ones in pregnancy, and do them on regular basis.
And because of COVID, I understand one can't really be regular with walks outdoors. But it's a good idea to wear some kind of a device which will help you measure the number of steps. So walking within the house can be a very good exercise, which will help you not only also it will prevent excessive weight gain.
Yes, and like now because of the AQI level in Delhi NCR, again stepping out is a little, probably you might think twice before stepping out, and plus it's COVID, both the things happening together.
Double.
So please do not end up gaining excessive weight being at home with the festival time going around. So keep a track on your weight gain, avoid excessive weight gain, and stay active at home. Try to walk indoors and keep doing your regular exercises. That will help you to stay fit during these tough times of pandemic.
Yes.
And ma'am, what about if we come to the post-delivery bit? Because most of the mothers have this common complaint that post-delivery, again, they experience a lot of back pain. Some of them think it's probably because of they took an epidural, or it's because of the LSCS or spinal anesthesia. So anything particularly in this segment that you would like to mention, especially when moms complain of back pain after delivery?
One thing I would really like to emphasize is, since you brought it up, and it's a very good point, many people experience it after pregnancy, and especially the ones who have had C-sections and got spinal or epidural anesthesia, they think it's because of that. So let me tell you something with absolute conviction: cesarean, spinal anesthesia, or epidural anesthesia will never give rise to backache. That is the biggest myth. If your back was good, it will be good. If your back was bad, there is no way these things would have contributed in making it worse.
Right.
So, that having said that, vitamin D supplementation, calcium, important is posture while feeding, while changing nappies, especially just bending over and changing nappies.
Very important point.
Yes, it can be extremely stressful. Then in our Indian setups now, thankfully because of COVID, thankfully or whatever, it's less. But sitting with your back unsupported for long periods of time, just chit chatting or whatever. That should be really avoided. Be very careful about your posture, and then please understand you would all be busy once the babies come, and your hands will be full. But at least half an hour or even 15-20 minutes of back stretches and exercises will go a long way. Be consistent with them. So these are the points which you should remember, and please continue to do them. It takes about 6 to 8 weeks for body to come back to its normal state. So you can start with gentle stretches postpartum, and then gradually build up. And once your 8 weeks are done, you can even start with your core exercises. Core muscles can be built, the hamstrings can be worked on, and back issue is sorted. There is no need to worry about.
Absolutely. So, in fact, we at Rosewalk also teach the mothers before the discharge of the basic simple exercises that they can do, whether it's a normal delivery or a C-section. And the idea of those exercises is to maintain the blood circulation, to stimulate the joints so that you don't get joint pains and you don't get issues like back pain, which is commonly seen. So, best is that I also mostly advise moms is that, spend 2 minutes after every feed. And after every feed, if you spend 2 minutes in the entire day, it will always be like about 10 to 15 minutes. So every feed followed by some 2 minutes of exercising of all your joints will help you to maintain good blood circulation also and prevent stiffness in the joints.
Yeah, however, either 15 minutes at one go or you want to space it out, but just keep it as a part of your schedule. I would just like to add that many times backache is because of some kind of nerve compressions or long-standing disc herniations and all also. So in that case, please be sure to follow your orthopedician's advice and be very careful while bending forward. Rather, it's advisable not to bend forwards and not to really stress your back. Please bend at your knee. Don't. In those cases, it's a different story. Be very careful and be under the supervision of your orthopedician and physiotherapist even during pregnancy. So that is a case where medically you need management, and please continue with that.
And again, a lot of commonly seen thing that, when you mentioned the typical Indian massage, it just got to my mind as well. A lot of times you will see, many mothers recommending their daughter-in-laws ki delivery ke paas pocha lagana start kar do. And for someone who's never done it, who's probably gained a lot of weight and is not even able to sit down properly, and she's forcing herself to do the mopping in the house that she's never done in her life, can also lead to back pain in those cases.
Of course, because you're not prepared. It's a strenuous exercise. However, if you have been a very active gym person, you're used to doing squats or lunges or those kind of things, then it would be probably you would even kind of enjoy that. but not if you've never done it. You've never squatted in your life on the floor or sat cross.
Exactly, and then they're going around and doing the mopping, and then the next day morning they can't wake up because they feel the
Yes.
back has become very stiff. So again, if you're planning to do that, please make sure that your back is strong enough to do that.
Yes, best way is to gradually build up things. Don't be on either side of, where 0 is not doing anything and 10 is stretching, really stressing yourself out. Stay somewhere between 6 to 8 on that scale.
Yeah.
You will be happy and comfortable.
Right, right. And ma'am, any extra care that one needs to take in case somebody is experiencing back pain in pregnancy and like probably wants to undergo an epidural anesthesia in labor. So is there any extra care that needs to be taken, or it's absolutely safe for those people to take an epidural in labor even if they have a history of back pain in pregnancy?
It's absolutely safe. Because you would be many of you wouldn't know that epidural is in fact recommended as a treatment for refractory back pain which has not responded to any other measure. So epidural is never a contraindication for giving backache. For giving backache is never a contraindication for giving epidural. However, if you've had a history of surgery on the back or disc herniations at many levels, it's better to meet us and discuss with us so that your anxieties are also not high on the day of the delivery, and these decisions can be made together before the onset of labor. Otherwise, backache because of weak muscles or wrong posture or generally because of some deficiency, that's perfectly fine. You can always take an epidural.
Right, and in case you feel that these measures are not effective for you, it's good to talk to your doctor about it so that you can actually find out the real reason for your backache. So, ma'am, anything on that note you want to say?
I would just like to say that as you've covered, please involve the specialist and the physiotherapist and orthopedicians if you feel that all these measures are not working, and also talk to your gynecologist about that. I would just say that there could be few red signals which you should not miss. Now, suppose there's some new onset of backache, or there's a kind of the type of backache has changed. For example, initially it was dull, suddenly you feel it's kind of shooting sharp pain, radiating and all. Get in touch with your doctor, and suppose now it's the pain is also going to the abdomen, then don't neglect it. Don't just keep doing these measures at home. Contact your doctor and see how it goes from there.
Yeah, you never know. Towards the end of the third trimester, it might just turn out to be a back labor.
Yes, it might
So,
start
yeah.
with labor, not just during the end of third trimester, even during
Preterm also.
preterm
Yeah.
labor. It can be
So
sign of
that's
preterm
why-
labor also.
Yeah,
So we don't want to miss that.
Yeah, so please make sure that you do discuss with your gynecologist
Yeah.
about it also. So great, wonderful. I think we covered almost everything about back
Yeah.
pain in pregnancy.
Yes. One last thing which I would like to again emphasize: stress has been recognized as one of the leading causes of backache. Though I might attribute it to anything else, but directly or indirectly. So please, if you feel stressed and you have a backache, they could be directly related. And just sit and think whatever techniques would suit you to relieve that. It could be any mindfulness based reduction technique of stress, or it could be something like a guided meditation, or just sitting and watching your breath, taking deep breaths. All that will help because they will help relax muscles, which would include back muscles too, and that will really prevent backaches.
Right. And for that, we do conduct a program here called Bump Prep, which is a prenatal well-being program, again, under which we cover all the mind, body, and soul exercises to help you establish that happy, relaxed state of mind and body during your pregnancy. So you can enroll in our Bump Prep program by Rose Walk Luxury Hospital for Women, and we are located in South Delhi. So do visit us if you're a pregnant mom to get the feel-good factor that we get to experience here since we are working here, and you can get an opportunity for us to give a chance to pamper you and feel that what most of the patients who come here and get that the same feeling that they experience here. Yeah, you can also get to feel that. We have a question here from the audience. Okay, so the question says, my wife just delivered 2 days ago, but she's still suffering from extreme back pain. Does she need any physiotherapy treatment?
See, if it's not relieved by general measures, just see. Sometimes even deprivation and sitting for long hours during feeding can lead to a lot of backache. I don't know what the history is. Was a did she have backache before pregnancy also. But in case it could be just due to stress. And simple, first if you try simple measures like I said, a gentle massage, some kind of hot fermentation supporting the back, seeing if the sleep can be as proper as possible. I understand with frequent awakenings that can't be helped, and she's feeding properly. She's not when she's bending, she's not bending too much to change the nappies and all. And if it doesn't settle by these methods, please see a physiotherapist and get it sorted.
I think it'll be good, and also please maintain the right feeding posture for her. She can use a feeding pillow also for a better posture. We have one more question. My wife is 7 months pregnant. Is physiotherapy required to get rid of the pregnancy backache?
Again, as we discussed, that would depend on case to case.
Yeah.
What is the cause of backache? Is there anything like a disc herniation involved, or it's simple muscle weakness? So if it's persistent and it doesn't resolve by methods we already discussed, then you need to see a physiotherapist. The idea is that it should not be so uncomfortable, as in it should not disturb her daily life, and she should not be in pain.
Right. So I think you can try all the natural ways, and if it doesn't help, then yes, better to get a further consultation for it. Right. Yes. Do we have more questions here? Yes, one more question we have. Please suggest some yoga exercise to avoid pregnancy back pain.
I think that
Cat camel,
they
back
can,
stretches, ham stretch.
Yes.
So there are lots of yoga asanas specifically for strengthening the back muscles, which will help you. And like ma'am and I had mentioned, strengthening plus stretching, both are equally important. So you can do the cat camel yoga asana. You can do your cat camel position leg raises, which will again help you to strengthen your low back muscles.
Do a session on especially these exercises.
And otherwise, you can come and see us at Rosework, and we'll help you do all the back strengthening and stretching exercises with us.
Simple exercise like leg raises with your toes completely stretched, and just alternate leg raises. They could also help.
We have one more question. Where does back pain in early pregnancy occur?
It can be anywhere. See, if you're sitting at the desk for longer time, basically early pregnancy, because of the effect of hormones, all the ligaments and joints in the body and the back start relaxing. So if you're sitting at the computer for long hours, then even you can have some sort of upper backache. And again, it can be a lower backache also, but in that case, it will not be because of the size of the uterus or the growing up fetus. It could be just because of the relaxed ligaments and an already bad back. So it could be anywhere, basically, to answer your question.
In any specific area in the entire spine, it can be anywhere. We have one more question. Why does back pain occur during pregnancy? I think this was what we covered.
This was what we covered. It could be because of the effect of hormones, because of the effect of the growing uterus and the fetus, because that causes a lot of stress and stretch in the entire abdomen area, in the back area. So basically, as the body is preparing to give birth and for the labor, there is an additional stress which is placed on the body. The curve of the lower back, that increases to more than what it was before pregnancy. So all these things, these are the common causes of backache.
I am 8 months pregnant. How can I get rid of my severe back pain?
Depends what it is for. Like we answered in the previous question. Please try doing the stretches. Do whatever the other measures like posture, your calcium, vitamin D levels sorted, taking frequent breaks, getting up, not bending too much. All the methods we discussed before this can be used. And if it's still not sorted, then you need to see a physiotherapist or an orthopedician.
Right. That's it. So thank you so much, all of you, for joining in, for watching this live, for interacting with us. We totally enjoyed interacting with you, and thank you so much, ma'am, for sparing our time. It was lovely.
Most welcome. Thank you for having me.
Thank you, everyone. Bye-bye. Take care, and wishing you all a happy Diwali.
Yeah, happy Diwali,
Happy
everyone.
Diwali
Have
from
a safe and
Rosework
happy
team.
Diwali. Bye.
Bye.